Hello and welcome to this special EULAR preview podcast brought to you by the Lupus Forum. My name is Ed Vitale. I'm a professor in translational medicine and a consultant rheumatologist at the University of Leeds in the UK and chair of the steering committee of the Lupus Forum. And today I'm joined by Professor Chris Edwards, who's a consultant rheumatologist at University Hospital Southampton NHS Foundation Trust and honorary chair of clinical rheumatology in the University of Southampton. Welcome, Chris.
Thanks very much, Ed. I'm looking forward to discussing EULAR.
Yeah, me too. So it's going to be really busy. We've all been looking through the abstracts as they've been sort of coming out, I think, and trying to look for highlights. So, what were some of yours?
Okay, so I looked at it in different ways, and I suppose we can think about it by subject areas. We can think it about the type of sessions, whether they're posters, whether they're poster tours, and the sort of big ticket things as well. And when you stick in lupus into the search engine on the EULAR website, I think there's 17 sessions that have lupus in the title. It's more than 190 publications, so there's lots of information, and there are seven sponsored symposia as well, without talking necessarily about the detail of those. Um, and it's a pretty optimistic spread to me of newer things, and some of the therapies that we've used in the past. If I start with some of the bigger ticket items first,
Yeah.
there's some EULAR recommendations, and those are always really popular, aren't they? Because you get a summary, usually from a group of experts, and you can have a look and see what people are thinking, not just from the evidence base, but with a bit of weighing up clinically what's pragmatic, what we can do. So there's Demetrius Boumpas is talking about the lupus. I was almost called it lupus nephritis, but I assume it's specifically called kidney disease in lupus, or lupus kidney disease. And I
Mm.
suppose that's maybe saying there's a greater spectrum of kidney disease than just nephritis. I don't know if that's something you've seen people call it something different sometimes.
Yeah, or maybe a pushback on the idea that these are like two separate conditions that you sometimes get from clinical trials and
Yeah,
licensing.
yeah,
Yeah.
yeah, yeah, yeah. Okay, maybe that. But I was interested in that, and at a meeting a year or so ago, we were debating why there's that change. So anyway, if we go to the session, no doubt we'll find out that difference. There's also our colleagues in the health professionals group, the HPR group. They've got a recommendation around looking at non-pharmacological treatments,
Mm.
because it's very easy, isn't it? As clinicians, we get interested, and we're going to talk about, I'm sure, new mechanisms of action, cells, cytokines, antibodies. But for patients, pragmatic approaches to treating their symptoms of pain, and fatigue and brain fog, those things are
And as
important.
As we often say, the best outcomes aren't just about choosing particular medicines, it's about the whole way that care is delivered as a totality, really, I
Yeah,
think.
yeah, and
Yeah.
also what the person with that RMD, with the lupus, feels at the end of the day. We've got to have some objective measures, haven't we? But those subjective things about how people are feeling are important. So those were two kind of recommendation
And there was
associated.
another one, actually, which
Mm.
is on Friday. There's a session called
Yeah,
Treating Challenging Manifestations of SLE.
yeah,
So
yeah.
this is a project I was involved in, and I do feel it's been really, I found it really helpful, even as from hearing from the other people in it. So this one was the idea of what do you do where there's a lack of evidence. So for the
Mm,
sort of rarer features of lupus where you won't really have trials, and this was led by Lorano, and what was done was getting expert consensus on the way they treat certain rarer features
mm.
until people could vote on which ones had the most support. So it's really useful where you haven't got any other information to know what's the most common approach amongst experts. The paper's just come out in Lancet Rheumatology, and there's another set
Yeah.
to go. But here there's a focus with talks on the pericarditis bit, the neuropsychiatric, the liver. The
Hemolytic anemia was in there as well.
Yeah, yeah,
Where
that's
when it's
right. Yeah.
isolated hemolytic, yeah, I saw that, and actually, you can see it's of interest for people because in some of the other medical press, some of these emails we get sent from organisations telling us about what's the rheumatological news. This was picked up, this publication, so I was pinged it a few times by different
Yeah.
organisations. So I guess compared to the other recommendation, this will be the reason this is so important is for the reason you said. There's there isn't going to be a randomized control trial that tells us exactly what to do, and therefore it's going to be a mixture of case series, anecdote, and sensible experts saying on balance we think this is what should happen. So
Yeah.
yeah, so I think that one's a really good one.
Yeah. Biggest question I get if I get asked to speak about a new therapy, anifrolumab, apindutuzumab, something like that, is always, can I use it for this? With all these difficult problems that people have.
Yeah,
And
all
you
the
always
impossible
say,
stuff.
yeah.
Yeah, all the impossible stuff. What others? Another sort of big ticket one. I think this is on Friday. Antonis Fenuriakis is talking about is it's a win session. So what is
Oh
new
yeah.
in lupus? So that sort of we're getting towards the end of the week. Big session, and I guess within that there's the opportunity to cover the updates on everything, and it will be interesting to see what's in there. I guess new drugs, the CAR T story, lupus nephritis, and triple therapy. Seeing what he might include in that, but that caught my
Yeah.
attention as well.
And then also at the end of
Anything
the
else? Yeah.
At the end of the conference on Saturday, you've got the late
Mm.
breakers, which includes a pretty big lupus trial. So there's a new positive trial. It's a phase two, which is
Yeah.
enpatoran, which is this TLR7/8 inhibitor. So it's one of those
So
more,
the toll receptors. Yeah.
yeah, and so it's a completely new way of treating lupus, and there are some quite impressive effects seen there. So that's quite exciting. That's something that I expect we'll probably see going through to phase three on the back of those results.
Yeah. So that's another newer. I suppose we've been thinking about toll-like receptors for a little while, but that's important data, isn't it, to see that?
Yeah.
Uh,
So
I
then
mean,
on
for me,
the
yeah.
mechanistic
Go on.
things, I saw a
Yeah.
few things as well. At the start of the conference, unfortunately, as always happens at EULAR, there's three things that I want to go to all at the same time.
Yeah.
So
But luckily, there's catch up afterwards, isn't there? So you can
yeah,
watch
so
it
at
afterwards.
2:15 on the Wednesday, there's one that's about CAR T therapies and beyond. So this talks about CAR T, which we've heard about a few times, but also some other cellular approaches like antigen-specific Tregs, so
Yeah.
regulating the immune system in a trained way. Then there's a
Yeah.
session on type 1 interferonopathies, which is really important for pediatric lupus and generally to help us understand pathogenesis. So, well, I'll
Absolutely.
definitely be going to that one because I'm chairing it. But
Okay.
there's
Better be there.
there's three talks. One's on genetics, one's on clinical presentations, and one's on therapy. And then at the same time as that, there's another one. Now, this is an interesting counterpoint to the whole CAR T B cell depletion thing, because this is a session that's all saying, what about all the mechanisms of disease that aren't B cell, which is
I
really
saw that.
important.
So that's
Yeah.
that's a basic and translational medicine session,
Yeah,
isn't it? Not all B cells myeloid related. Is that the
that's right.
sort
So
of mechanism inflammation as well?
Michelle Kallenberg's been publishing for a while about how the skin induces cutaneous lupus. And this part of the story is about how this interferon-rich environment then changes the dendritic cell behavior.
Yeah.
Virginia Pasquale is going to present about how type 1 interferon also regulates IL-1 secretion by monocytes, which I always think as two sort of different types of
Yep.
inflammation, I guess. And then there's Andrea Favia talking about myeloid cells in the kidney. So
Yep.
yeah, I can't go to them all, so I'll be catching up on the others of those.
Yeah. Okay. And then, I mean, what I also was taken by is just the spread of different things. So the different diseases, and two that I know much less about. So, there are bits of extra data around belimumab, of course, and anifrolumab. There's a bit of JAK inhibitor work. There's the deucravacitinib, some of the deucravacitinib skin data.
Hmm.
But the ones that also stood out because I thought I want to go to those sessions so I understand more was the dapirolizumab and also the cenerimod. So two different mechanisms of action. One that's an old mechanism of action that people are going back to, the CD40 ligands
Yeah.
story. And then I think in in neurological circles, the cenerimod idea has been used a bit more. Not that I don't know the same drug, but within multiple sclerosis. But it's this sphingosine phosphate receptor modulators and how they affect signaling and trafficking of lymphocytes. And I haven't quite got my head around exactly. I'm imagining in the membrane. I'm imagining it affecting the signaling. I'm imagining how that might keep lymphocytes in
Yeah.
certain places, but I haven't quite got what that means
But
and how to
yeah,
judge it.
that's right. That's an emerging one, and but the I suppose the interesting thing is, like you say, that based on that mechanism of action, you think it might have a lot of applications across a lot of different autoimmune diseases.
Yeah,
Yeah.
yeah, absolutely.
So then, as you say, lots and lots about CAR T cells all through the
Yeah,
Congress. Several different sessions on those. There's one at the so there's some with overview talks. There's a session on and then there's a session on Saturday that's beyond CAR T cells that looks at other
yeah.
ways of targeting B cells. So there's other new B cell therapies. There's Georg Schett is doing a talk about the BiTEs, the B cell T
The
cell
T cell
engagers.
engagers. Yeah,
He
yeah, yeah.
tries to do the same thing, but with a monoclonal antibody to bring the B cell and T cell together.
And that's different, isn't it? Because
Yeah,
because it's effectively two arms of antibodies stuck together that
yeah.
bring the T cells and the B cells together, rather than having a cell involved in that process.
So instead of having to take your T cells out and
Yeah,
reprogram
yeah,
them, we just
yeah.
give a drug that will make them do
Stick them
that job
together. Yeah,
in
yeah,
vivo. And then
yeah.
there's also a big presentation in there on ianalumab, which is another one of those emerging modes of action. So this is this biologic that targets the BAFF receptor, which is a bit like the belimumab mechanism of action, because that's what BAFF binds to, or BLIS binds to, but it also kills the B cell.
Yeah, yeah.
It's combining two things in one. So if it can, it'll kill the B cell. But if it can't kill the B cell, like there aren't enough T cells or NK cells around, then it'll still kind of starve it of BAF. So uh,
Mm.
that's
And
all. Yeah,
and I suppose that speaks to that there are a few of the different mechanisms. So the CAR T is being mentioned, but there are a few posters, presentations that are around the different forms of that. So the standard anti CD19 CAR T, then there's some CAR NK, natural killer cell. Then there's some of these two binding site CAR Ts against CD19 and BCMA, which have been presented before.
yeah,
Then a bit less B cell depletion, I guess, is the T cell engager, and then obinutuzumab, and then rituximab, and so it goes on. You get this spectrum, but all of those different ways of doing CAR therapy and B cell depletion are being mentioned as well.
yeah, exactly. And even some more even new data on a drug we've been using for 20 years with rituximab, actually. So
Mm.
it's, for example, I saw one of the poster tours. There's one from Mia Rodriguez from Manchester, which is about analyzing the treatment trajectories with rituximab. So, in other words, trying to get away from this response this day compared to this day, and look
Yeah,
about how does that curve
and
of
was that using some AI, some machine learning or something
yeah,
in
that's
that
right, that's right,
to
yeah.
plot out those? Yeah.
And there's some more data, mechanistic data from the obinutuzumab trials. And there's one of our own, my own abstracts, which is
Mm.
about rituximab super responders, which is
Yeah.
something we did because of the talk about drug-free remissions with CAR T therapy. We sort of said, well, we sometimes see that with rituximab, don't we? You sometimes see patients who just have an amazing response. And so we went back through all our data going back since 2005, so 20 years of data, and looked back and found like a whole bunch of people who'd got more than 3 years response, many of them coming off their background therapy. So they've relapsed
Mm.
in the end, but it took more than 3 years, which is it seems to put them up there with the data we've heard from these novel therapies. So
Mm.
I,
Mm.
I find that kind of intriguing,
Yeah,
actually.
yeah, yeah.
Yeah. Okay, so I think that's most of the main highlights. There's an
I
awful
think
lot.
it's covered most of it. I mean, it's a pretty good spread of stuff, isn't it? We've to me, what the part of the mood is, there's loads of different mechanisms of action and completely extraordinary bits of immune system Lego of
Yeah,
creating therapies around the CAR T and B cell depletion, and then all these other new mechanisms of action as well. The
yeah,
sphingosine, the
yeah.
CD40. I think really
It's
interesting.
definitely accelerating. So,
Yeah.
so if people want to see more of the detail on those, there's a highlights brochure that we've produced. So we've identified 35 abstracts across the conference, covering a wide range of topics as our highlights, and listed lots of the other things that you might want to go to. There's also another one of those, by the way, on for other autoimmune rheumatic diseases, so rheumatoid, psoriatic arthritis, axial spondyloarthritis, and scleroderma, on the IMID forum and the scleroderma forum. So those would be worth having a look at too. So with that, I think it's way over to the conference. So next week we'll all be there and catching up on this in person. So I hope you've enjoyed our preview podcast. We've got lots more EULAR content planned for this year in Barcelona as the conference gets underway. So look out for the daily highlights that'll come out each day of the conference to tell you what to look out for that day. And as always, after the meeting, we'll be doing another one of these podcasts where we'll review what we've seen and reflect on those. And that'll be me and Chris again. So that'll be a great opportunity to catch up on what was presented. And don't forget to visit the Lupus Forum, lupus-forum.com, and download those materials. Thanks very much.
Thanks.